Hi, this is Dr. Glen Ellyn, Illinois. Welcome to our webinar on high comfort dentistry for high fear people. I want you to know some of the options we have to keep you comfortable. Certainly realize if you do have dental anxiety, you certainly are not alone. More than half Americans do not seek regular dental care, and about 15% will have even avoided critically needed care. Lots of health issues that are related with this type of problems here. Bad dental health is related to heart disease, stroke, diabetes, decreased overall lifespan, some cancers, other systemic diseases, bad breath, premature births. Lots of problems there. And there's even lots of types of dental fear: pain, embarrassment, not getting numb, needles, sound, noise. What do you have to do to try to have visits that you aren't going to be too fearful of? First of all, gain control. Talk to your dentist. Let them know that that you have these anxieties here. Learn as much about the procedure. Learn as much about the office. Communicate. Don't be embarrassed. If you are worried about the dentist not stopping or anything, get some type of hand signal. Usually raise a hand, tap on the chair, whatever it takes. Let them know. Certainly don't try to hide your anxieties. Discuss pain control. We have lots of ways we can get things much more comfortable than the past. One way we have is something called the magic wand. The wand uses instead of the old-fashioned syringe many people have nightmares about, uses actually a little microprocessor to deliver the anesthetic. We even have better anesthetic solutions than we used to, ones that will soak in better, last longer. If you had problems getting them in the past, doesn't mean you would at this point in time. We even have solutions now where you can, during cleaning visits or root planings, this is the anesthetic solution that soaks into the gums, makes cleanings and hygiene visits much more comfortable. Many people hate the noise. Headphones are also a very good source of distraction. We have in our office over 200 CDs. Many people even bring in their iPods, blast it. Many people this helps quite a bit. We try to find problems earlier now than we were able to in the past. This is something called diagonal dental laser. It actually finds decay earlier than we could before. Some dentists even have the laser. The laser is used by about 5% of dentists. I now do more than half of my fillings using the laser, and no pain, very fast, very quick, very easy. Many people complain that they have painful x-rays in the past. We now use digital x-rays, uses 90% less radiation, much easier x-ray. We can see it on the screen. You can see it on the screen. Nitrous oxide, this is one thing that many patients love. Nitrous oxide, we can quickly change the amount. Some people absolutely will not come without it. We oftentimes even use it to augment oral or IV sedation for more of the advanced cases, but this is certainly a fantastic adjunct for many, many people. Anxiolysis, I'm sure many people have heard about getting a pill such as Valium before they go to the dentist. Very good way to alleviate some of the fear, discomfort, anxiety. You do it to have something drive you to start to take something like this. And for, again, more advanced cases, there is different types of sedation: sleep dentistry, IV sedation, pill dentistry. The state of Illinois is one of the most restrictive states in the country on this. Here I have a slide saying, beware just a little pill. I say that because even though the pills and stuff work very, very good for some people, they don't work for everybody. That's why we do have other options such as IV sedation. Again, what works for one person does not work for the other. Talk to your dentist, make sure they're well trained to take care of the particular anxiety you have. This is why I say, by all means, let them know your anxieties, and they should hopefully be able to give you the options that would be most appropriate to you. Embarrassment and guilt. I'm amazed by how many people come in and say that the last office made them feel guilty, embarrassed. We won't do that to you here. That should not be done. if you have any concerns, by all means, let your dental office know. Too busy, too many appointments, no time, very, very common type of problem. Sometimes if we can make you comfortable enough, we can get much more done in far fewer visits and much more comfortably. Safety, yes, you do have to be well trained to do some of these procedures. But again, imagine no embarrassing smiles, no pain, no fear. Hopefully we want to get to the point where you can just have easy cleanings in the future, your problems are well taken care of. Comments from patients, go on our website, take a look. We have lots of feedback from patients who have had many good experiences. People list credentials. Really, our credentials should be the feedback we get from the patients. And our experience, yes, we have had a lot of training to be able to do some of the more advanced procedures nowadays. You do have to be well trained. And if you aren't ready for this type of dentistry now, you know somebody who has fears, anxieties, concerns, let us know. There certainly are solutions. Go to our website, fearlessdentalcare.com. We have a blog site in there with a lot more information. You can call the office direct at 630-858-8800. And if you want more information, we're more than happy to send you a free report. Just call, no obligation, no operator, just leave a message, 888-371-0641. Thanks for listening. Have a great day. Bye-bye.